name is Scott Baker, and I co-host Spine Fit Radio with Dr. Sean Riley from Tulsa Spine and Rehab. Recently, I've had some back pain myself and had to seek the care of a chiropractor. Unfortunately for me, I don't live in Tulsa, so Dr. Riley wasn't an option. In this fourth and final episode, we talk about the common confusion surrounding chiropractic care, and Dr. Riley explains the role of pain medications. So talk to me let's talk about chiropractic care just in general. And you, again, talking about the importance of word of mouth. And some of the friends that I have talked with since I began this treatment, and even the doctor I'm going to see right now, have made a statement similar to this. Well, it just depends on who you see if you're going to get results or not. Because I shared with him a story. I saw a chiropractor many, many years ago, probably 7-8 years ago. Didn't have a lot of results. Went to physical therapy, had almost immediate results. And his comment was, well, just depends on who you see. Here we could have, and friends, again, some friends have great stories, other friends, not so great stories. Why is that? Why does there seem to be a level of inconsistency in chiropractic care?
Well, sadly, I mean, that's a very good point. And I guess maybe a couple of things. First off, I think that, maybe some of the training, some of their philosophy, and I don't want to say philosophy, but some of the way they practice might be a little outdated. And meaning that, they were trained that, manipulation is the gold standard of care and it's good for everyone. And I go back to tools in my toolbox, and I'll speak to that here in a second. But let's say, a certain chiropractor gets kind of honed in on doing the same thing every single visit for every type of condition. Well, I mean, I think that you and I would both agree if you have a sinus infection, you might be treated totally different than if your shoulder hurts. I mean, you got to determine what the issue is and then treat it accordingly. I think that some chiropractors as well, they don't think outside the box to incorporate other providers. Not to say that, just because I want to incorporate other providers, Scott, doesn't mean I'm not good at what I do. It just means that I might need some help treating them a little more efficiently. I mean, does that make a little bit of sense? I mean, I think that there's a chiropractor probably down the street or, here in Tulsa or somewhere that's just as good as me. But I think what I have on my side is that I have resources and other people around me that are able to do different things. And hopefully that's what gives me an advantage. Those patients respond a little bit better. Sadly, I think it turns into like you're literally trying to sell yourself. And I'll tell you a quick story that when I first started practicing, I was so excited and I would talk to patients about what their problem is. And I found myself talking more about me. Like, this is what I can do for you, almost to the point where I was am I trying to convince them that what I can do will help them? As opposed to just laying out, this is your treatment plan, and research shows this is effective for what you're dealing with, and this is what you should expect, and then that's it. And just, I stopped talking at some point about, okay, this is what this office can do different than this. I mean, just lay out the facts in front of them and let patients make decisions on their own. Back to the toolbox analogy, I've got a bunch of tools in my toolbox, and I'm proud of that, as opposed to when I first started practicing, I only had one or two, related maybe to manipulation or adjustments, and then maybe a soft tissue technique or two. Now I have, chiropractors who do different things, physical therapists who specialize in different things, acupuncturists, naturopathic physicians, yoga instructors, fitness and massage therapists, and so on. We even have an osteopathic physician here now that does some manipulation. So, I think that, if you can treat a condition more comprehensively, I think care is going to be more effective and patients' responses will be higher. I sadly hear horror stories all the time about, I went to this chiropractor and this happened or that happened. Early on in my career, that was my plight too, to defend the whole profession as a whole. And I took it quite personal. And like I said, nowadays what I do is I just talk to the patient that it was unfortunate. This is the way we do things here. This is what you should expect. And this is the way we're going to go about treating it.
So as I was considering my options in seeking care, again, talking about taking more pain meds, that sort of thing, I thought, well, I don't want to just do that, but I might want that in addition to the treatment I'm getting at attacking the source. And so I wondered if chiropractors can prescribe drugs or not? And if not, does that put you at a disadvantage?
I'm asked that every day. Just out of curiosity, Scott, what was the chiropractor's thoughts, or what was his take on medications? Did you visit with him about that, or did he have any?
No.
Okay.
No, because in my state, they can't do it. So it never really came up in terms of prescribing drugs.
Sure. The reason I asked is because a lot of chiropractors are adamantly opposed to prescription drugs. That's definitely changing. And so forth. As chiropractors, we do not have prescriptive rights. We're not able to write prescription for pain medications and so forth. I know there are groups and so forth out there that are trying to maybe get prescriptive rights for, basic type medications, anti-inflammatories and so forth. So I do believe in prescription drugs. I think that, just like I spoke to the point that early on in a case, if a drug can help us with inflammation or managing pain. I work closely with a pain management facility here in Tulsa, and I send out for injections quite frequently. If we can do things to combat the inflammatory process and so forth to make you feel better enough where I can get you exercising and do some of those types of things, I think it's great. Do I think that I need prescriptive rights? Absolutely not. I think I'm really good at what I do. Conservative type approach with exercise and manual therapy and those types of things. So, I'm a fan of it. I think that obviously you go to your primary care physician and they're going to write you a script for drugs. If indicated, use them. Hopefully they'll make you feel better. But at the same time, I think it's a good idea maybe to get checked out to determine what the issue is. Sadly, a lot of medications, they're going to treat symptoms. And unfortunately, they can cover those symptoms up. So, let's say you do have acute low back pain and, you take a narcotic or an opioid or a pain medication and they make you feel better. Well, you think you're fine. And then you go out in the yard and start picking up whatever, and you hurt yourself even worse. So I think that you need to be careful with that as well. I would encourage you to find a chiropractor that, work closely with primary care physicians, and you could kind of take more of a tag team approach.
That's all the time we have today. For more podcasts from Dr. Riley and his team, be sure to visit TulsaSpineandRehab.com.